Chronic inflammation could be silently sabotaging your health, and it's not just about your genetics. Today, we're going to uncover the root causes of chronic inflammation and what you can do to silence it starting today. Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to your health concerns, and welcome to the Wild Wisdom Show. Today, we're going to be talking about the surprising root causes of your inflammation, foods, toxins, and hidden triggers explained. So let's start with the food. Now, this may or may not be surprising to you, but ultra processed foods are a significant inflammation trigger, but they have to be the kind that have food additives inserted in order to do things like increase shelf life, increase the taste, compensate for things that have been removed. So if, for example, it's low fat, they may have added sugar. If it's gluten free, they may have added other components to make it taste better, or dairy free. And so therefore, when we talk about ultra processed foods, they could even be labeled as healthy or organic or natural. But the key is to look at that ingredient list and see, are there chemicals in there, names that you don't recognize, or added sugars? And there are at least 56 different names for sugars. So you have to get pretty savvy when you're assessing your favorite snacks, things like the protein bars or granola bars, or again, dairy-free, gluten-free, organic, and so on. So don't get misled by what's on the pack in terms of trying to sell you on that product. You really want to read the ingredient list and understand, are there any additives in there that could actually be causing inflammation in the gut? And the thing is that 70% of our immune system is in the gut. So when we have gut inflammation, it really triggers the immune system, and the immune system travels through things like our blood vessels and the lymphatic system. So while the inflammation could start in the gut, it could then spread through actions of the immune system to other parts of the body, like your brain, your eyes, your sinuses, your skin, your joints, your muscles, intestines, liver. So local gut inflammation can become body inflammation in other parts, and that can be determined by your genetics, what part's going to be more affected than. But the root cause can be those ultra processed foods and added sugars. So you want to get really good at investigating those ingredient lists. Additionally, we want to talk about blood sugar spikes or blood glucose spikes. We know that when we eat foods with too much sugar in them, table sugar that's added to things like baking or teas and coffees or your drinks or meal, you want to reduce that as much as possible. Obvious, or like your candies and your baked goods and your treats, but there can also be not obvious sources like foods that have too much refined flour, and that easily breaks down into glucose and can also cause what's called a glucose spike. And the reason that that leads to inflammation is because when we have a glucose spike in the body, we also have an overproduction of the hormone insulin. And insulin hormone is very important to have in good amounts, but when we overproduce it, over time, we can get issues with things like insulin resistance and inflammation as a result of that high insulin production. Some people will even use a continuous glucose monitor for a period of time just to make sure that their glucose levels aren't persistently going too high, which can contribute to inflammation in that long. Now, another source of inflammation is from sitting too much, not being active enough. Lack of movement fuels the fire, so to speak. Daily movement, at least 4,000 steps a day, getting in that exercise that targets your cardiovascular system, your strength, your flexibility and balance, and understanding that over-exercising can also cause inflammation. So it's not about overdoing it. It's about finding the right balance for your body, targeting all of those aspects of fitness, not just focusing on one thing like too much cardio or too much strength training. You want to get all of that in, plus your balance and flexibility for an overall balanced approach to not having too much inflammation, especially as we age. This becomes very, very important. Now, another inflammatory trigger is poor sleep. When we don't prioritize sleep, when we go to bed too late, when we choose to watch movies into the night or our shows or surf the internet or social media, rather than prioritizing our sleep, that can be extremely harmful for inflammatory levels in the body. And if we do things inadvertently to disrupt our good quality sleep, like eating too late, you don't want to eat a couple hours before bedtime, that can really disrupt your ability to go into deep sleep. And so getting that circadian rhythm down, where it's going with the natural rhythms of the body, eating at the right times, going to bed at the right times, making that a priority, can be a significant help when it comes to lowering inflammation. And when you look at my lists on my YouTube channel for Dr. Patricia Mills, MD, what you're going to see is a playlist on how to maintain good hormone health, because deep sleep really affects hormone health. And you're going to see there a video on how to protect deep sleep, how to optimize sleep in order to have good hormone health. You might want to check that out for some very health. Now, the other thing that we're all aware of is long-term stress causing inflammation. When we talk about long-term stress, we're talking about overproduction of the cortisol hormone, which is the hormone of the stress response system. And again, we want to have enough cortisol so that we can get up in the morning, get that energy to go and do things for the day. But as the day goes on, we want the cortisol to go down. We want to feel more relaxed in the evening so that we can drop off into that deep sleep. But if we're having instant triggers on our stress response, our to-do lists, our activities in the day, whether it's related to work or caregiving, we want to make sure that we balance that out with relaxation triggers. So things that get you deeply relaxed, that could be breath work, meditation, going out in nature, some relaxing exercise and stretching and yoga, anything that calms your nervous system so that we can reduce that stress response. Heavy exercise, intense exercise is not the solution for this aspect. Those can improve your fitness levels, but it won't help reduce your stress response. So we really are looking to introduce those very calming, like Tai Chi, the breath work that was mentioned, forest bathing, thing that causes you to feel deeply relaxed can really help calm that cortisol stress response. Now, everybody's aware of this, but it bears mentioning because sometimes we lose sight of interconnectedness of things in our body. But when we smoke, whether it's smoking marijuana or tobacco, drinking excess alcohol, which becomes more important as we age, our liver is less able to detoxify alcohol as we age. So what you were able to tolerate in the may no longer be what you can tolerate now. So cutting out or cutting down that excess alcohol is very important. We want to rely on repeatedly over time. Essentially, we want to reduce the inflammatory load. We want to turn down the volume of inflammation so that as we turn down that volume of inflammation, everything in the body settles down, including inflammatory pain. Your detoxification systems can only handle so much. So you want to make sure that we don't overload those systems with things like smoking, too much alcohol, recreational drugs. If we can manage to reduce that, that can be extremely helpful. Every choice counts here. Now, the other one that we need to be aware of and not put our head in the sand, but just confront it head on, analyze it, and see if we can reduce the exposure is from pollution and chemicals. Those things cause oxidative stress on the body, which leads to inflammation. Oxidative stress is basically the body's being assaulted by these toxins, and it's trying to deal with it through oxidation and other mechanisms, but we can overwhelm those systems, and over time, we can get inflammation. And that can come from air, from water, from work environments, from things we put on our skin, what we clean our house with. And for example, in my local community, our water supply is high in iron and manganese. And so those need to be filtered out in order to avoid an overload of the system. In some communities, it may be too much arsenic. And we know that those kinds of minerals require filtration systems. So testing your water just to make sure that you don't have an unknown heavy metal or mineral burden can be very important. Understanding that waters can be high in microplastics, hormones coming through the water, pesticides. And so getting at least a good quality carbon filter for your home, whether it's underneath the sink so that what you're drinking is filtered through that carbon system that's installed. Maybe it's one of those pitcher filters, but making sure that at least that the air that you're breathing and the water that you're drinking, the soil that your foods are grown in, how you're cleaning your home, and what you're putting on your skin is very, very key for reducing inflammation. And it used to be that women were more at risk for the skin burden, but men now are also increasingly putting more products on their skin and on their hair. The average woman is exposed exposed to more than 300 chemicals a day just from things that we put on our skin and on our scalp. So being aware of our cosmetics and our body lotions is very key. And again, I do have many videos on this topic, and you can search my YouTube channel to find out ones that go into this in much more detail. Indoor life, it has become the norm in our society, and knowing indoor can have some issues that we need to offset, either with specific supplementations or strategies to mitigate the risk. Because when we are indoors, we have a vitamin D deficiency due to decreased exposure to the kind of light that causes vitamin D production in our bodies. Vitamin D deficiency, one of the number one deficiencies I see in my patients. And often we need to supplement vitamin D, particularly in those fall, winter, and spring months, and depending on where you live. So obviously, if you live more north, you're going to need more than if you live in more south and more sun exposures. However, there's some people, even, high countries, that are really avoiding the sun because they want to be sun safe and sun smart, reduce cancer risk. But there's a balance there that needs to be had as well. And if we're not exposing ourselves to enough sun, we do get into vitamin D deficiency, and that can contribute to inflammation over time. Depending on where you live, also there can be indoor air pollution. So you may want to get a filter for that indoor air, depending if you have pets and what is your exposures. Maybe there were chemicals put inside your home, like on carpets, getting those stain removal products, they can be high in toxins. Scotchgard, for example, those kinds of chemicals. So being aware of allowing good airflow in your home, ventilation and filtration can be very helpful over time. Nature is very anti-inflammatory, so get outside when you can and be good about looking at your indoor exposures when you are in. Now, the next root cause has to do with dental health. Dental infections are very prevalent in our society. Even though we are going to the doctor, to the dentist often and getting our teeth checked, we are also having procedures like wisdom tooth removals, root canals, and they can result in long-term infections being hidden in that area of previous work. So sometimes getting very low dose CT scans or cone beam CT scans or specific imaging that are better than x-rays. Sometimes you need to go to a biological dentist who has those kind of extra special equipment that is not available in the regular dentist as of yet, looking for those hidden infections and cavitations. And those, if detected, should be treated, because it's hard for the immune system to get to those infections that are deep in the jaw. And so the immune system tries to get there, but isn't quite successful, but that activates the immune system. And again, remember, the local inflammation can become systemic, spread into the other parts of the body. So making sure you don't have any hidden infections from previous dental. Also implants. So when we get implants into our teeth, some implant materials, including titanium, can cause an immune system reaction. The body's reacting to a foreign object. And again, some biological dentists will be able to help you navigate that. There are some blood tests that test activity, certain dental materials that are commonly used. That's something that I've done for myself. And I now, whenever I get any work done on my teeth, or I have night guard made or anything like that, I make sure that what they're using is biocompatible and isn't something that my immune system is reactive to. And that part, again, seems to be a combination of genetics and previous exposure. Another aspect of implants are breast implants and other medical implants. It is well documented that when we implant things into the body, foreign tissues into the body can mount an immune reaction to that tissue, recognize it as foreign, and react against it. And sometimes it can be very localized and very low level, so it's not something you would notice very. But in some people, again, perhaps genetically, or maybe it's the overall toxic and immune system burden that it's being exposed to, it can mount a more aggressive immune system response that can be local or spread systemically. So while the implant may have been local, for example, in the breast, or like a hip implant from a hip surgery or hip replacement, that inflammation can again spread systemically. So it might be brain fog, fatigue, aches and pains. When they do research on women who have breast implants who have these symptoms, and then they remove the breast implants, around 50% get better. So that research is still ongoing. It's a topic that needs to be more deeply explored, and doctors are becoming more aware of breast implant syndrome, illness syndrome. And so these are things just to keep in mind. And again, it's not that everybody who has breast implants or an implant from joint replacement surgery, for example, is going to develop problems with this. But when I look at people with inflammation, we go from the most easy to control and within our influence, such as our diet, for example, our sleep, our stress, looking at environmental pollutions and exposures, looking at how I clean my home and what I put on my skin. And if after doing that for some time, at least 4 to 6 months, I don't see a significant improvement, then that's when I start to recommend that people go see a biological dentist and looking for those hidden infections around the teeth, cleaning up that dental area if needed. And if that's not enough, then we go down the road of looking at sensitivities and reactions to implants, because those are harder to deal with. Sometimes it can involve a repeat surgery. As a physician and specialist in physical medicine rehabilitation, it's pretty rare, but I have seen people to those implants from the hip surgeries and knee surgeries, for example, and needing that changing of material. So it's not something we want to go to right away, especially because it is a very invasive fix, so to speak, but addressing all the other root causes first, and then going down this road if necessary over time, just to maintain that holistic picture, because for some people this is a big thing and for some people it's not a contributor, but just keeping it in mind. So the good news is that you have more control than you think. It's about looking at your diet, really prioritizing natural whole foods, minimizing ultra processed packaged foods, making sure you get enough movement, not too much, not too prioritizing sleep and diving into the research that really protects that deep sleep, stress care, and supporting your natural systems of detoxification while reducing the burden and the load is very important. They all matter. And I'm going to be doing an episode on my next Wild Wisdom show that will talk specifically the systems of detoxification and things you can do to support them so that you can reduce that inflammatory load. So feel free to also explore my inflammation playlist on YouTube as I create more videos on this very important topic. That's where I'm going to be putting this content. My YouTube is Dr. Patricia Mills, MD. Please subscribe to my YouTube channel. That's the best way to support this show. Also, save and share. Sharing is caring, and you never know when someone might benefit from this wild wisdom. Thank you so much for joining me here today. I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this, and I'll see you next time. Bye now.